So, good morning girls, my name is Fiona and thank you very much for having me in your classroom today. At the end of this micro lesson, you're going to be able to name the 2 treatments that we perform with a galvanic unit. You will also be able to identify what actually happens to the skin surface when you actually use these treatments. But before we go on to that, I'd just like to take a step backwards first of all and just talk about 3 key elements that are very important before you perform any kind of electrical galvanic treatment. And they are your contraindications, your precautions and your sensations. So what we can do is we'll start with our contraindications first of all. Can you put your hand up please if you know any contraindications to galvanic treatment? Yes?
Pregnancy.
Pregnancy, but very well done. Anybody else? Yes?
Epilepsy.
Epilepsy, good. Yes?
Pacemaker.
Pacemaker, brilliant. Yes?
Metal implants.
Metal implants, brilliant. Anything else? What about if somebody has a lot of dental work? Do you think that might be a contraindication?
Yeah.
Yeah, okay. So there's some of the key contraindications you need to think about before you even turn your machine on. Next we come to our precautions. How do we perform this treatment safely? Can anybody tell me any precautions?
No
Yes.
water.
No water where?
Near the machine.
Near the machine, well done. Yes?
For the therapist and the client to remove all their jewellery.
Perfect, yeah, you can't. And why is that?
Because it will just heat up.
Yeah, and it's metal,
Yeah.
so that's brilliant. Good, good. Anything else? Any other precautions? Yes? Yeah.
No frayed cords.
No frayed cords, thank you.
I was going to say.
You were going to say that? Yeah, and think about your machine. What's important about your machine with precautions? Yes?
Make sure that the leads are put aside so you don't trip over them.
Well done, yeah. And keep your dials down, make sure your machine is turned off, very good. And the last thing is your sensations. What is your client going to actually feel on her skin? Can anybody tell me any sensations? Yes?
Possibly heat.
They might feel some heat, absolutely. Anything else? Yeah?
Tingling.
Tingling. They might feel a slight tingling sensation. And yes?
I think you can have like a metal taste in your mouth.
You absolutely can. That's a very common sensation. And you need to warn your clients about that. So well done, girls. I'd like to talk about some of the 2 treatments you can do with this piece of machinery. Now the first one is something called desincrustation. And what desincrustation does is it's actually a deep cleansing treatment and it helps soften the sebum and deep cleanse the skin. Who can tell me what you think I might have in my hand? Salt, exactly. I've got some table salt in my hand, and the chemical name for table salt is actually sodium chloride, and it's a solution of sodium chloride, or an alkaline solution that we put on the skin before we run a galvanic current, and that's what gives us desincrustation. Now the other thing you need to know about desincrustation is it's only ever used on a very oily skin. Because it's deep cleansing and it's degreasing, you only use it on skin that has a very shiny effect, has a sort of a thickened appearance and open pores. The next treatment is something called iontophoresis. What do you think this is?
Water.
Water, absolutely. And iontophoresis is used to infuse water-soluble ingredients into the stratum corneum. And it's those active ingredients that can treat all skin types. So depending on the actual ingredients, you can treat all skin types with iontophoresis. So they're your 2 treatments that you can perform with your galvanic machine. Has anybody got any questions? No? Okay, I'll move on. So what I'd like to talk about now is, how do these actually work? What are the differences? So we'll talk about desincrustation again. Now with desincrustation, when you put your salty solution on the skin, you're actually creating a strong alkaline, and that alkaline is called sodium hydroxide. And when you've got that strong alkaline on your skin, that sodium hydroxide has 2 effects. The first effect is something called saponification of lipids. And what happens there is that the sebum in the skin actually gets converted to a soap. So it has a really degreasing effect in the skin follicles. The next effect is something called proteolysis, and that is the protein breaking down and the keratin breaking down on the skin and in the actual follicles. So that's how desincrustation works. With our iontophoresis, we've got our water-soluble ingredients, and they're actually infused into the skin. And they're infused using a two-stage procedure with this very machine. The first stage is actually called anaphoresis, and it uses a negative pole called a cathode. The second stage is called cataphoresis, and it uses a positive pole called the anode. Now, the thing about anaphoresis and cataphoresis is they have a couple of effects on the skin that are quite different. So when you're working with anaphoresis, the first thing that's going to happen is that your pores are going to open. So that allows the product to penetrate. It also softens the skin. The blood circulation is increased. Your nerve endings are stimulated, and it leaves the skin to be slightly acidic. And therefore all those water-soluble active ingredients can penetrate deep into the stratum corneum. And they stay there. But really, you don't want to leave the skin like that. So what we do is we go over to our machine and we just switch it. We just switch it over one switch, and that then changes it to cataphoresis. Now with cataphoresis, it changes to, you're going to close those pores up, you're going to harden the skin tissues, you're going to decrease that circulation, and you're going to calm and soothe those nerve endings. You're also going to build up to a more acidic acid mantle to restore the skin. So does anybody have any questions for me? Okay, I've got a couple for you then. So, with your galvanic current machine, what are the names of the two treatments you can perform with it? Iontophoresis, good, yeah. Anybody else?
Desincrustation.
Desincrustation, well done. What is sodium chloride commonly known as? Salt, yep, table salt. And what skin types do we use water-soluble ingredients on?
Oily, is it?
No, all the others. Oh, okay. You can use them in all different skin types. Okay, so what I'm going to do now, ladies, is I have here just a revision quiz. There's 10 questions on it. What I'd like you to do is I'd like you to partner up, work in pairs, and then you've got about 15 minutes to complete it, and then we'll go through the answers. So if you could be so kind just to pass those out for me. Thank you. Okay, ladies, how did you go with that? Good. Okay, so we'll just go through the answers. If you'll pop your hand up for me, please. Name the two treatments that use a galvanic current for skin care. Yes?
Desincrustation.
Yep.
Iontophoresis.
Very good. Okay. What galvanic treatment would you use for the following? Oily skin. Yeah. Desincrustation. What about dry skin? Iontophoresis, well done. What about dehydrated skin? Iontophoresis. And acne skin? Desincrustation. And what about sensitive skin? What would we use for sensitive skin, do you think? Yeah, iontophoresis, because remember, depending on how you put what you put in your water-soluble substance, you can treat all skin types. Now, the first stage of iontophoresis is called? Anaphoresis. The second stage of iontophoresis is called? Cataphoresis. The positively charged pole is called? An anode. And the negatively charged pole is? The cathode. Very well done. That's really good work. So those last 4 questions about the anode and the cathode, anaphoresis and cataphoresis, that's what we're going to be discussing at length in our next lesson, how that actually really works and the really deep effects on the skin. So that, and also just this information I will be putting on SharePoint for you, the PowerPoint and the revision quiz with the answers, so that you've got a record of it. And I'd just like to say that concludes our lesson. Thank you very much for having me in your classroom.